For those of you who are wondering, yes, we are 4 minutes late. We had to restart our computer. And yes, I'm on a wooden chair that makes weird noises when you scrape it across the tiles. That's what makes life interesting. Welcome to this week's Chat with the Docs. I'm Mo Wolf, acupuncturist and senior lecturer at the Siloam Center for Traditional and Integrative Medicine. You like that new title?
I like that.
Just made it up.
You can have it.
I didn't even have to send $25 to some address in the back of Popular Mechanics to be able to call myself senior lecturer.
Perfect. I'm Dr. Noel here at the Siloam Center. I'm the chiropractor here.
And last week we were talking about Lyme disease, and we barely even scratched the surface. Mm-hmm. And we had such a good time doing it. And we had such great feedback from you guys that we wanted to continue with that. However, I've got an announcement to make. I have to disclose this to you. Ready? I have to say that this is a sponsored video. Would it be sponsored video or would it be a sponsored contest? We're going to do another contest, but this is just for this video.
Cool.
Okay. The makers of Be Rescued Propolis Rescue Balm have said that we could give away one of their rescue balms. They will mail it to you, directly to you from the manufacturer in Rhinelander, Wisconsin. So what we're going to do is we're going to say like, subscribe, and comment on the video. And when this video gets 100 likes, not views, we're going to go for the gusto. When this video gets 100 likes, we're going to do a random generator and find out who wins this balm of this can of Rescue Balm. Rescue Balm, that's phenomenal. Rescue Balm is like the WD-40 or the Swiss Army knife of your medicine cabinet.
Is that the one that you recommended to me that time?
Mm-hmm.
That stuff's awesome.
It's phenomenal. Or as one of my teachers in med school would say, phenomenal. Dr. Jen, if you ever see this video, I'm sorry I just butchered your I can't do it like you do. No one can do it like you do. Anyway, first 100 likes, and we will give one of these guys out. We are still running the like, subscribe, comment to any one of our videos. Mm-hmm. And at the end of the month, we're going to pick someone who has liked, subscribed, and commented. And we're going to be giving away one bottle of Orthomolecular's vitamin D with K2. Mm-hmm. That is not a sponsored contest. Giveaway, whatever that's called. That's from the goodness of our own heart. Mm-hmm. The cockles of our own heart. And now you know I'm not a cardiologist. Cardiologists wouldn't say cockles. They'd use the Latin. Anyway.
This is unscripted, guys. That was my first time too with that one. So
this is unscripted. In fact, you had patience right up until the last minute.
Yep.
I had patience up until about 15, 20 minutes too. Mm-hmm. And the beauty of this program is, no, we don't sit down and write out, I'm going to say that. No, This is just banter back and forth. Two practitioners who are very passionate about what they do, who are talking back and forth about, in this case today, Lyme disease and some of the co-infections of Lyme disease. We're passionate about it because we've seen it destroy people's lives.
Oh, yeah.
We've seen people's lives absolutely gutted by this illness. And as we talked last week, it's more often than not misdiagnosed or just completely undiagnosed.
It even seemed like last week after we kind of closed the show and that we had more people coming up with questions, concerns. Did we get any more through web-based or more just kind of coming up through patients?
I've had patients all week asking follow-up questions. But yes, I was here for another 15 to 30 minutes last week just answering questions on the Facebook feed and on the YouTube channel.
Is that kind of how you want to start off today? Is kind of going through some of that, or because I can't even remember where we left off last week. So
yeah, who is that creepy dude? That's me. Hero, you do amazing work. I don't know how you do that. By the way, you guys don't see this because he's over in the Philippines right now, but we've got Hero doing the engineering and all of the technical stuff, trying to make do with our lousy tech and make it work. So kudos to you, Hero. So where did it go now? I'm just trying to look for some of the comments from last week.
I guess I had one that came in very flared up for their upper trap neck region. Looked on their back and they had some of those long, like it looked like scars.
Uh-huh.
Have you seen it from actually growth spurts going, the long way instead of the up and down way? Versus, is it a Babesia that also has that presentation?
If I remember correctly, that's usually Bartonella.
Bartonella. Okay.
That's usually the Bartonella that presents like that. But because those stretch mark looking features are so common, especially in this part of the country, we've got a lot of heavier people.
Well, not even heavier, because it's not the stretch marks, going down.
But
the sides. It's
correct.
The opposite.
Correct.
It's in the middle of the back.
Correct. But because we have a larger population of heavier people see those practitioners see those marks and they don't think anything of it.
Okay.
They think, it's just a stretch mark.
Okay.
But you're correct, because when these things are going vertically instead of layered, that should be a red flag.
Mm-hmm.
I, quite frankly, don't see too much of it, because for my acupuncture patients, for their sanity and their safety, and for my safety, I usually don't have them disrobe.
Okay.
Sometimes I'll put some needles into the scapula, and so I'll put a gown on them. But most of the time, it's elbows down and the knees down is what I'm working with.
Yeah, that's true.
So I don't normally have people disrobe and take a look at those things. For me, what I'm doing is I'm gathering information. I'm gathering their complaint, what their subjective complaints are. Mm-hmm. Subjective meaning it's how the patient interprets it. I'm observing how their movement is as they're walking in. I'm observing their skin tone. I'm observing how their eyes are moving, speech patterns. I'm looking for anything that's out of the ordinary, and I'm looking for patterns.
Yep.
And then I combine that with my pulse diagnosis. Mm-hmm. And what I'm noticing is the pulses for Lyme disease and the co-infections are not the classic GU syndrome pulses. In Chinese medicine, you have something called GU syndrome, which is why I practice this, because it falls under the scope of my practice. GU syndrome is dealing with parasitic infections. And it's got this really crazy history going back a couple thousand years, when you had this period where you had this medicine starting to come out, where these practitioners were starting to treat for worm infections, viral infections, things like cholera. And then they realized, wow, we're making a good living. And so what they would do is they would go into a town and they would take a bunch of dead snakes, dead bugs, live bugs, anything that they thought might transmit some of these parasites, throw them in the well, poison the well, get everybody sick, and then come along a few months later and say, oh, I can heal you. This would be a good time to insert a joke about an insurance company, but I can't think of any right now. I'm sorry, I'm flat-footed. 4F, that's Mo. Anyway, so then that became a real problem. And so then the practitioners the medical practitioners of the time who were relied upon, they started looking on them as suspicious because they started finding out these people are poisoning the wells so that we get sick, so that way we pay them more cash. I think the classical Chinese term was moolah. Anyway, the government got involved, and the warlords, and then eventually the kings got involved and banned this type of practice. But those that were practicing legitimately already had these observations that they'd recorded: pulse types, presentation types, herbal treatment protocols. And the interesting thing about those classic protocols was they like to use a formula called Suhe Tang, and it used a lot of aromatic anti-parasitic herbs. It used a lot of just really harsh parasitic herbs. It had a lot of liver opening, liver qi moving herbs, liver dilating. Yep. And they would change it up every 30 days. Every moon cycle or so, they would change it up. Because what do we know about parasitic infections?
Isn't the moon kind of wakes it up?
The moon wakes it up, but they also learn quickly and adapt. Think of Lyme disease.
Yep.
If you just use the same treatment over and over on Lyme disease, it'll never get better. Because the Lyme will say, that does not affect me anymore.
It's kind of like any kind of virus.
Yes.
Year to year, like the flu virus, it changes.
Exactly. But the Lyme changes much more quickly.
Okay.
And so the ancient Chinese would change up the treatment every month or so, and gradually these patients would improve. So there's been a resurgence in the last 30 years in Western Chinese medicine, in that we've got Lyme disease. We've got Lyme disease paired with all these co-infections. And you get these people that are going to their naturopath or their health care practitioner, chiropractor, acupuncturists, these practitioners that are treating Lyme, and they're treating it in the ways that they know how. Sometimes it's IVs, sometimes it's hyperbaric chambers, sometimes there's a guy that uses ozone therapy in the blood. But the problem is, when you just kill the Lyme, you're lacking, because Lyme doesn't travel by itself.
All the little buddies with it.
It travels with its buddies. It's got groupies. Think of it like the Rolling Stones. They're creepy looking enough. Great. Now Mick Jagger's going to sue me. I got nothing.
He's laughing. It's so
good. Sue me. I dare you. Anyway, so you've got the Lyme, and it goes into the body 40% of the time. It's coming into the body with helminths. Helminths are not funny hats that protect you. Helminths are microscopic little roundworms. What's interesting is you talk to dentists that do live blood analysis. They're hard to find, but you'll find occasionally a dentist that'll do live blood analysis, and they'll take a swab from the back of someone's teeth, and they'll be able to point out the different bacteria. Oftentimes they'll be seeing spirochete, anaerobic spirochete, hello, Lyme disease. And they will also see these little worms. And then they'll take a sample of the person's blood. They'll see the little worms in the blood as well. They'll take the plaque off the back, they'll take a sample of blood, and you'll see these little worms. Those are called helminths. 40% of the tick bites have the helminths going with them. So what I see a lot of is, I see a lot of people with autoimmune issues, with thyroid dysfunction, autoimmune thyroid, Hashimoto's, and they come in and they've been everywhere, and they're just kind of maintaining. Their last docs have been playing with hormones, and it's just okay. It's some days it's helpful, some days it's not, but I'm not getting anywhere. And so then you start. I use the muscle testing to give me some idea of what's going on, and I check their thyroids, and their thyroids are full of helminths.
Wow.
So these little microscopic roundworms get into the thyroid, start destroying the thyroid. And what happens when the thyroid's not functioning?
All the hormones get thrown way out of whack.
Everything gets messed up. The thyroid's like a linchpin. It holds everything else in place. In med school, they teach you the thyroid the axis of the thyroid. It's more than that. There's more than just three aspects of it. The thyroid has its hands controlling so many different aspects of the body, and when these little guys get in there, they wreak havoc on it.
Makes it hyper or hypothyroid, either hot or cold, and
Either way, and sometimes the really sad ones, it goes back and forth.
And that makes sense.
So it's very difficult to regulate, and you know, their doctor says, "We'll just come in every month and we'll just check your TSH." Wait a minute, TSH isn't going to tell you diddly squat. TSH can change with the season. Here in the Midwest, there's always a rash of people coming in saying, "I want to use something natural to treat my thyroid," long about October, November. Have you noticed that? Why is that? It's because they're starting to get tired. They go into their doc for their physical, and the doc says, "Well, let's check your blood." And the doctors around here only check TSH, thyroid stimulating hormone.
So not T3 or T4.
Not free T3, not free T4, not thyroid antibodies. And so then this TSH is going to be off, and they say, "Well, we've got to get you on levothyroxine. We've got to get you on Armour Thyroid, Synthroid." And the person says, "Okay," because what do they know?
Well, and thyroid is very common, so it's accepted.
And it's accepted. And so these people take it. The reality is it's fall. You're not getting the vitamin D that you used to. The seasons are changing. We're adjusting to this change in light. We're adjusting to the change in the time. And so the TSH gets thrown off by that, gets thrown off again in the spring. So you can't judge a book by its cover, and you can't judge a thyroid by the TSH. How's that for
as
deep?
the world adapts, we have to adapt with it.
That's right.
So things need to change.
We need to stay ahead of it and become very astute with the patterns of the diagnostics and how the diagnostics are weak in some areas. The other co-infection that I see in the thyroid quite frequently, and this is really cool, flatworms. You see helminths in the thyroid. You can also see little fluke-like critters getting into the thyroid. How they get there, I'm assuming it's through the bloodstream. And there's weakness there in the thyroid to begin with, because infection likes to go where there's weakness. The infection doesn't like to go where your body's defenses are strongest. Infections like to go where it's weakest.
It seems like glands. Usually if things go wrong, like cancers or stuff like that, it seems like it's gland tissue. Prostate, breast tissue, thyroid.
Lymphatic.
Yep.
And all of these glands are vulnerable to infection. And when infection isn't treated, and infection just sits there simmering for so long, that's when you start having the mutagenic effects on the DNA. That's where you start having cancers born. You start studying cancer, and it's at some point you will get to the argument, is it a virus? Is it something else? Maybe it's all of the above. Maybe it's chronic infection left to fester and go crazy, and now that's had such a mutagenic effect on the DNA that the DNA is now shot. If you're wondering why you're about to hear a horn blowing, it's because our neighbors are driving by. The Wisconsin and Southern Railroad and they've got to let everybody know that they're going to cross the road. You hear that? I don't know if you can hear the bell or not. No, they didn't blow the horn yet. It's coming. Anyway, there we go.
I like that rumble though. It's like it's a peaceful rumble.
There's something lonely about a train. For me, there is. You hear the train rumble, you hear the whistle blowing, and that Doppler effect as it's carrying it out, and you think, oh, sort of like when you hear the first cicada of the year. For me, I always go, oh, because that means that summer's about half over and school is going to start.
Yeah, that's true.
I hated school. Anyway, enough of that. We told you this isn't scripted. This is just two practitioners chatting. Anyway, hence chat with the docs.
Mm-hmm.
So we've got the helmets. We've got the flatworms. Where do you pick up a flatworm?
Soil.
Can you just run to the dollar store and pick up a liver fluke?
I guess if you go barefoot.
No shoes, no shirt, no service. It's Crocs. Anyway, yes, you can pick it up. You can pick up flatworms through the bottoms of your feet from walking around barefoot. You can pick up roundworms that way. Not just helmets, but other roundworms, pinworms you can pick up that way.
Mm-hmm.
These guys can blow on the wind. Remember that 1960s protest song, Blowing in the Wind? Well, now we know what is blowing in the wind, and I wouldn't recommend it. Anyway, where did you find this jerk? Anyway, you poor thing. You can pick these things up just in the wind.
They're pretty much unavoidable.
They're unavoidable. They're part of our environment. Another co-infection is mold. Mm-hmm. You get mold spores in the wind, in around you, in your buildings. You have a water leak around a window, you're going to have mold there. What does mold produce? It produces spores. A lot of times in the afternoons and evenings and nighttime, those spores get let out and people start having all kinds of problems. Those get into the lungs and you can end up with aspergillosis. Dogs will often get aspergillosis because they're sniffing around on the ground and they inhale the spores. And aspergillosis is a fungal bacteria in the lung. And what the lungs do is they will find these areas of infection and they'll wall it off.
To try to protect the rest of it.
Same thing they do with tuberculosis.
Mm-hmm.
They form these little cystic tubers in there, walls, and try to cover it off. Well, what that does is that then decreases, your lung function, because now you don't have that same square footage that you used to have for all of your alveoli to get that oxygen transfer back and forth. Mm-hmm. Then, if you get enough of it, then you get edema in the lungs, which takes that wall tissue between the inside of the alveoli where the oxygen's hitting it, mm-hmm. and that outer wall of the artery, that real tiny micro artery, capillary. Thank you. Yep. I appreciate that. And it makes a thickening in there, and now that oxygen can't transfer back and forth.
It holds
fluid, and you end up with respiratory distress. Mm-hmm. Doesn't just happen from colds, flus, and COVID. I know this is supposed to be a COVID-free zone, and I said it. I'm sorry.
Hit the tip jar. Well, not the tip jar, the swear jar, the COVID jar.
I'll throw myself around after the show. How's that? By the way, dandelion tea. It's not too shabby. So these co-infections, we look at Lyme and we think in terms of autoimmune. We think in terms of joint pain, mm-hmm. unexplained joint pain that moves around, unexplained muscle pain, mm-hmm. fibromyalgia, chronic fatigue where you're just really tired all the time. But it's more than that.
It's neurological.
It's neurological.
Like we said last week. Yeah.
It's neurological. It can get across that blood-brain barrier. It can cause psychosis. It can destroy your lungs.
That's what was
I'll
with yours.
never be a world-class yodeler. Have pity on me. Anyway, so we were just going to touch on some of the co-infections with Lyme disease. Some of those co-infections, I don't know if you can see this or not, but I've got my little cheat sheet iPad down here. Life is good. Everyone should have a cheat sheet iPad. So the first co-infection we're going to talk about is that mysterious, that femme fatale of the protozoa world. No, I'm not speaking malaria, although it's very much like malaria. We're speaking of Babesia. How's that? Think of Garbo, but in a protozoal sense. So Babesia is a protozoa co-infection to Lyme disease. It's very similar to malaria in structure and in function. And it likes to infect the red blood cells.
Okay.
So this is where you start having the fatigue issues. This is where you start having the oxygen starvation. This is where you start having anemia.
Okay.
Well, you just need to eat more liver. You need to take some more iron pills. Wait a minute. Maybe we should ask why we're
Why so
having
low?
the anemia. It's transmitted obviously through ticks with Lyme disease, but it can also be transmitted from mama to child. So if you
Okay,
have Lyme
breastfeeding.
disease and you're pregnant and you have a Babesia co-infection, which is highly probable, remember, they're like Shriners. They just go together. See, I didn't pick on Mick Jagger that time. Lawsuits are a terrible thing. By the way, we made it through another week without any cease and desist letters.
Perfect.
So it can be transmitted to an unborn child. So you can have Lyme disease and Babesia, and your baby's born, and your baby can be born with these things.
That's not too many things that do get transmitted like that. That's
highly specialized.
it is.
That's really remarkable because not even certain medications or supplements can get across that placental barrier. But it can also get across the blood-brain barrier, which very few things can get across the blood-brain barrier. I'm going to touch on a controversial issue here, but that's why they have to put certain polymer molecules into vaccines to get them across the blood-brain barrier. Why they need them to go across the blood-brain barrier, I don't know. It makes no sense. You don't get the flu in your brain, but they do. I'm going to not pull out my aluminum hat, and we're not going to go down that road.
Not today's show.
Not today's show. We'll save that for another show when we really want to get kicked off of YouTube. Most blood banks, and here's another thing that'll blow your mind. Okay, you've got a disease that can be debilitating and even life-threatening. Most blood banks don't screen for it.
Mm-mm.
Are you kidding me? So,
I don't even think they used to with hepatitis back in the day.
No, they
Like,
didn't.
You could get hepatitis through a blood transfusion. Like if you went through like a surgery,
Yeah.
like you didn't do anything abnormal, you could end up with that.
if you went through a surgery and you got out the other end without any kind of weird infection, they should have given you a t-shirt. I just had surgery and all I got was this lousy t-shirt. That's what they should have been doing.
Mhm.
They charged enough. So what are some of the symptoms of Babesia or babesiosis? It sounds intriguing, doesn't it?
Mhm.
Babesiosis starts with high fever and chills. As the infection progresses, patients may develop fatigue, headache, drenching sweats, i.e. night sweats, yin deficiency, muscle aches, chest pain, hip pain, and shortness of breath, also known as air hunger. And here's clinically for me, when I get a patient that comes in and they're saying, I don't know why I can't walk across the room without panting. I've had stress tests. They've told me, oh, there's nothing wrong with you. But what's going on with me? First thing I check, Lyme and Babesia.
And if you got night sweats, that's usually not a good thing. No
Right.
matter if it's Lyme or if it's other things that we'll talk about later on in shows. But yeah, that's a concerning factor.
Well, and night sweats in Chinese medicine are a yin deficiency. The yin does not get damaged until the qi is damaged. The qi gets damaged first, then the yin gets damaged. And once that yin gets damaged and you start getting heat in the body, enough heat to cause those night sweats, then you've got some real pathological issues. So what do we have? We have heat in the blood. What is babesiosis? It's an infection that kills red blood cells. It's life-threatening to people with no spleen, the elderly, and people with weak immune systems. It can be made more difficult to work with people who have liver diseases, people who have low blood pressure. It causes severe anemia, and it can cause kidney disease, and which would lead to kidney failure. I've got a gentleman right now he came to me and he was stage 4 kidney failure.
Wow.
Classic Babesia, classic Lyme symptoms, and lousy energy. The poor guy was wanting to check out. He was in tough shape. Used the acupuncture to work directly on the kidney function, started boosting kidney function, used some herbs, started looking down started talking to him about how we treat Lyme.
Mm-hmm.
Started treating Lyme and Babesia. The guy's doing great.
That's awesome.
And we're only 4 months into treatment. He's convinced it saved his life. But he was one of those guys who would go to his cardiologist on this wagon load, this wheelbarrow load of pills, and went to his cardiologist and says, why am I not getting better? Why is it that just talking to you and getting angry, I'm out of breath? Well, I don't know. Let's do a stress test. I can't do a stress test. You can do it. No, I can't do a stress test. So then they do the chemical-induced stress test, which are horrible.